I'm Dr. Pavan Kumar, working as consultant pediatrician in Unam Hospital, Andhra Pradesh. So I'm really thanking for the Divi Chakra team for providing the opportunity to connect and share the knowledge with the viewers with my best possible knowledge. So with rising temperatures, especially during the summer seasons, dehydration can be quite commonly experienced, especially in children and young children. And I'm here today to explain you all briefly about dehydration in children and its various aspects that needs to be considered by the parents while taking care of their young children. So first of all, what is dehydration? Dehydration is discussed as excessive water loss or excessive body fluid loss in really considerable quantity that he or she cannot be able to function normally and definitely requires appropriate fluid correction. So coming to what are the factors that are going to trigger the dehydration? There are various factors that are involved in this. So we can come one by one. So it can be because of reduced water intake or it can be because of excessive water loss. So reduced water intake include any throat infections, any mouth ulcers, any tonsillitis, any upper respiratory tract infections like even common flu, common cold, and reflux conditions like gastroesophageal reflux disorders or any gastritis and even acute febrile illness where the child taste perception would have been altered resulting in reduced water as well as food intake. Excessive water loss can be one of the most common problem in causing dehydration, and among these, diarrhea was the most predominant problem causing dehydration. Vomiting, regurgitation, excessive outdoor activities during midsummer days, and very rarely it can be due to some kidney related problems, and excessive burns also can result in dehydration even in conditions like infection, severe infections, septicemia, where the child's ability to intake and absorb the water would have been compromised. And very rarely it can be even seen in some conditions like hormonal disorders like diabetes mellitus or diabetes insipidus, and some skin problems like eczema or dermatitis where the evaporative water losses would have been more than expected. So coming to what are the symptoms of dehydration that are commonly seen in children? Excessive thirst, children would have been very fatigued and would have been having irritability, having dry mouth. They would have complained about actually muscle cramps, headache, and even dizziness and sudden episodes of fainting. So how can I assess whether if my child is having dehydration? By looking at these common symptoms, we can actually easily assess whether the child is having dehydration. So these include dry tongue, dry lips. When the child is crying, they would not be able to notice tears, passing very less urine than actually what he is supposed to pass usually in the normal days. Sunken soft spot on the top of the infant head. We usually call it in medical terminology as anterior fontanelle or depressed anterior fontanelle, and dry or wrinkled skin. Whereas in severe dehydration, you can usually make it out by looking at the eyes. Very sunken and deep eye, child would have gone to acute weight loss, sudden weight loss, decrease the skin tone and turgor. So when you pinch the skin might be able to may not be able to retract normally. The elasticity of the skin would have been lost or reduced. The child would be having even low blood pressure, feeling drowsy or disoriented, and child would have been breathing very deep and rapidly, and cold and blotchy hands and feet can be noticed in children having very severe dehydration. So what actually dehydration and acute heat illness can cause in children? It can cause heat, very mild symptoms starting from heat cramps to heat stroke. So if it causes heat cramps, so children might notice abdominal muscle cramps, even leg and hand muscle cramps can be noticed. Even if it is heat syncope, children would have been noticed having weakness, fatigue, and fainting after excessively playing while or exercising while in the outside heat. So what is heat exhaustion? When the children suffer more in spite of having heat cramps and heat syncope, they would go for heat exhaustion, and it is for the long time. So it includes loss of appetite, nausea, vomiting, and muscle pains and cramps, and child might be agitated and will be irritable. So coming to very more serious problem in the dehydration when heat illness both coexist together, it is called heat stroke. So heat stroke is quite common in the summer days. So how can you recognize heat stroke? If the children have running with very high temperature, 102 to 104 degrees Fahrenheit temperature, or when the children are actually not able to behave and concentrate, they will be disoriented, not able to behave and concentrate on the given task, might be drowsy, unconscious. In very rare cases, when it causes brain damage, it might lead to seizure. So coming to the next question in our topic, how can I help my dehydrated child to get better at home itself? So we have to follow carefully all the instructions that are given by the doctor with respect to the feeding. Do not give any children who are less than 2 years unnecessary medications for diarrhea or vomiting unless if it is really prescribed by your pediatrician. Encourage your children to drink fluids that are unsweetened and more natural, like tender coconut water or oral dehydration solution or any Pedialyte or any electrolyte based preparations that are commercially available, and try to avoid sugary drinks or any carbonated drinks like soda or any flavored juices that are going to actually worsen the problem. And continue to the breastfeed if the child is less than 1 year without interrupting the feeds. If the child is having diarrhea, some parents will be having an assumption that continuing the feeding during diarrhea will actually worsen, which is actually wrong. So electrolyte solutions like ORS, which we have already discussed, might be helpful in slowly increasing the amount of water or hydration in the body. So we can actually give much amount of water and food to your child. And in case your child is running with high temperature, you can actually go for medications like paracetamol, which are already very safe in children in appropriate dose, and allow the child to take plenty of liquids, and you even have to allow them to take rest as much as possible. And while you are doing this, parents are allowed to watch for any signs of dehydration that get worse or it might be reverted back to severe dehydration. If my child is dehydrated, when should I call the doctor? So there are some signs where you have to call the doctor without any delay at home. So it could be continuous diarrhea, or where the loose stools or the frequency of loose stools would have been rising and it is not getting controlled at all, and the quantity of the stools would have been very more than what you usually see at home. Or if the child is having continuous vomiting, persistent vomiting more than 2 or 3 times in a day, where the child is not able to take as well, and the child is throwing out all the liquids inside from his body, so which will put him into the dehydration. And then the child is actually passing very less urine and very yellowish dark urine. Usually children are expected to pass 6 to 8 times urine per day. However, if the children are passing less than 6 times per day, it is a doubtful condition where your child might be landing up in dehydration. So be vigilant about it. And when the child is drowsy and lethargic and sleeping more, he prefers sleep and he's not active and is not going to be playful like in the usual days. In that case also, so you have to be having a very thorough information about the dehydration and to rule out whether the child is really slipping into the severe dehydration. So what is the treatment of dehydration? So dehydration can be usually treated at home if it is really mild. In some cases, moderate dehydration can also be treated at home. However, if the dehydration is very severe, hospital treatment definitely is needed, where your pediatrician might assess the child's status and might run few blood tests, and depending upon the baby reports, might initiate IV fluids, intravenous fluids, or child will be monitored for blood electrolytes and blood sugars, and also child will be given medications like antipyretics and also rehydration solutions, and child will be given absolute rest depending upon the child condition. So in case, what are the dangerous signs of dehydration, or what are the complications of dehydration? So dehydration, if it is setting in very severe dehydration and if it is not getting controlled in time, it might lead to very dreaded complications like coma, unconsciousness, death. All these are resulting because of very thick blood, because of concentrated thick blood because of water loss, which might affect the perfusion of vital organs like kidney, brain, and heart. So how to prevent dehydration at home? So as parent, you have to know how much your baby needs water or any liquid consumption per day. Usually 5 to 10 kg children or infants less than 1 year, they might require 1000 to 1200 ml of water per day, and children who are between 10 to 20 kg, they might require 0.5 liter max per day, and 20 kg can be considered maintenance daily requirement in any dehydration. In addition to the maintenance, the child is having dehydration, we have to provide the child condition. So by encouraging the children to milk, ORS, Pedialyte, these kind of solutions are available across the market. Hydrating foods like melons, watermelon, muskmelon, or so many other melons are available. Berries, pomo juices, and apple and banana. These are also in the water. They are also enriched with electrolytes that can help coping up with the dehydration and electrolyte deficiency during acute dehydration. More is actually required when the child is in the sunny day or when the child is playing in a sunny day outside. And avoiding sugary drinks, as avoiding carbonated water and flavored drinks. These can actually prevent dehydration. So currently ask questions about the dehydration. Fine. I think we have a question here. Hi, Naina. The question says, how much water child should drink per day? So ideally, this total their weight on 12 to 14 kgs. In this way, they require 1.5 liters to 2 liters of water per day, depending upon your child is having additionally any losses, diarrhea, vomiting, or require additionally 250 to 500 ml per day, in addition to the maintenance daily requirement. We can actually, there's one more question. Is there any natural treatment at home that's going to be helpful for children to cope up with? Exactly, that's what we have already discussed some time back. So you can actually encourage with plenty of water as well. Avoid distilled water or the filter which is excessively electrolytes. It is nothing but chemical, pure H2O water. It will not give any electrolytes, or which is actually purified from the process. And so we have natural water sources where the electrolyte much, like coconut water. Even you can give fruit juice which are mixed readily, and you can also encourage the seasonal available fruits like even ice apple, watermelon, even mangoes. And if the child is not able to consume directly the fruits, you can allow them in a liquid format. That could, and only come across with the parents when I'm treating children with diarrhea or dehydration. My child is going to feel better. Children are going to feel better only having some time to improve. So it might be children are having food poisoning. They might require at least 48 hours before they can come back to symptomatic free time. Or if the children are having any viral diarrhea or infection, it might take more time. Viral diarrhea is usually resolved within time, whereas bacterial infection, if not treated in time, it might prolong till 10 days. One more question we have got here. from the viewers. Is dehydration normal for newborn as well? Newborn babies, they have to take only the liquid diet, unlike their diet is mainly food along with the liquids. So newborns, when during summer days, especially, their hydration part mainly depends upon how it's going on, because most of the newborns, they will be on either mother milk. Some cases where the mother milk is insufficient, they might be on powder milk. So in that, encourage whatever the available mode of feeding and avoid giving direct wash. They can either mother milk format or which is express milk, whichever is available. We can suggest to the babies every once in 2 to 3 hours, like 12 times in a 24-hour period, to cope up with the regular growth needs of the baby. And coming to a few more questions, when will my child start to feel better? I think I have already explained this. Usually it might take from 70 hours for the children to come back to the regular normal symptom-free period. I need to bring my child back for a follow-up visit. Definitely, children diarrhea or vomiting, any acute water loss, we have to definitely have it vigilant. We have to be on hydration status in case if the children are not improving, if they're actually hydration part, they might be actually requiring hospitalization. That's why we talk at least 24 hours after the first visit as well as 48 hours after the second visit. Keep my home. Should I allow my child to go to school or take any kind of dehydration? Definitely no. I will not recommend allowing them to go for any child or daycare or any playful activities until they are completely fine. One more question here we have got from the viewers. Limit foods from giving children who are having any diarrhea or dehydration. Suggest avoid spicy food, even the carbonated drinks are commercially available uh, drinks where ORS, L or any kind of versions where they will be mentioned or misguiding that it is actually mentioned for hydration. It is not actually. Are there any certain foods limit? Exactly. So during acute diarrheal illness, dairy products, avoiding banana in case if the child, avoiding grapes and citrus fruits if the child is having severe vomiting to prevent. In some children might require might nil per oral when if they are actually hospitalized, and if they are continuously the full symptoms are getting controlled, we cannot allow anything orally. We have covered most of the questions here. So what are the usually recommend during dehydration or diarrhea? So usually there is levers. However, if the child is having any fever or any severe, we'll go for simple paracetamol in the given prescribed dose as per the weight regimen. And any over-counter medications we need to avoid during diarrhea. Definitely not try to give antibiotics excessively having diarrhea unnecessarily, thinking that it is not a safe thing, and we should also avoid giving loperamide kind of medication. Children are actually given in adults. So discussion regarding dehydration and the cause about what are the various aspects and what are the considerations needs to be. Finally, coming to the takeaway messages to the viewer, try to avoid giving over-counter medications which are not prescribed by the doctors, and particularly parents who are having very young children like infants, children, they are unable to express their problems. Even a slightest doubt about dehydration, try to visit the doctor and get their opinion rather than just sticking on to following home-based management. During summer season, I suggest try to maintain the appropriate liquids as I suggested, and stay hydrated and stay healthy. Thank you, viewers. Thank you, Chakratin, for giving me this offer this knowledge with you. Thank you.